Syphilis, a re-emerging public health challenge. My name is Manpreet Singh, and today I'll be talking about syphilis. What is syphilis? Syphilis is a sexually transmitted infection that is caused by STP. Although it is fully curable with common antibiotics, it is still transmitted through sexual contact and from pregnant individuals to fetuses. This diagram onto the right, it shows the syphilis cases in the United States, how they have increased gradually. And this is also a congenital syphilis case diagram as well. It is from the CDC itself. It shows the gradual increase as well. Although syphilis is fully curable, it remains a serious public health issue. Cases have increased worldwide in recent years. This is a picture of syphilis and how it attacks. Why is syphilis a public health concern? Syphilis progresses through multiple clinical stages. The first is the primary syphilis, then it goes to secondary syphilis, latent syphilis, and then tertiary syphilis. It can remain asymptomatic, allowing undetected spread. Untreated infections can lead to neurological and cardiovascular damage, and the rising rates of congenital syphilis are especially concerning. Many cases are preventable with early screening and treatment. And this diagram just shows how it goes from primary syphilis, secondary syphilis, latent syphilis to tertiary syphilis, 4 stages. The global epidemiology. About 6 million new syphilis infections occur each year globally. 6 million. That is a lot, guys. Over 300,000 fetal and neonatal deaths occur annually due to syphilis as well. It is the highest burden in low and middle income countries. This is because of limited healthcare access, diagnostic tools, increased transmission. Syphilis increases because of migration, and also because of poverty and conflict, worsen disease spread. And this just shows you how to, get tested for syphilis, protect your kid, because if it is not treated, syphilis can pass from mother to baby, which is called congenital syphilis. It is best to get tested for syphilis 3 times during your pregnancy. So it's better to be safe than sorry. Syphilis and HIV. Syphilis increases the risk of HIV. Syphilis sores weaken natural protective barriers. HIV and syphilis affect similar populations. Co-infections leads to worse health outcomes. Controlling syphilis helps reduce HIV. This just shows having syphilis can increase your chances of getting or transmitting HIV. So it is important to talk to your provider about syphilis prevention, testing, and treatment. Regular testing and treatment is very good, so it's better to be safe, like I said before, than sorry. Because if you get syphilis, it's easier to get HIV, and vice versa. If you have HIV, it's easier to get syphilis. Syphilis in the United States. Syphilis rates have increased steadily since 2000. I talked about this in my research paper as well. As you can see, this diagram shows you how it has syphilis throughout the states itself and how they have increased gradually. And historically, highest among men who have sex with men, syphilis occurs. Recent increases among heterosexual men and women have been shown. Significant racial and socioeconomic disparities, and limited healthcare access delays testing and treatment. This is also due to, poor access to healthcare, no insurance, no nothing like that, which is causing an increase in syphilis. And there's a lot of stereotypicals and, people are scared, to get even tested for syphilis because of what people might think and not. And congenital syphilis. This occurs when infection passed from pregnant person to fetus, which I talked about. It can cause miscarriage, stillbirth, neonatal death, or disability. Nearly 100% preventable with prenatal screening, which is very important. If a woman is pregnant, it is very important for her to do regular testings and make sure it is possible to prevent congenital syphilis. There has been rising cases indicating failures in prenatal care systems. A major warning sign for public health health programs. It's very important. It could cause stillbirth and even kill the kid. So it's better to have your prenatal screenings and make sure everything is on time and make sure you do all your testings. The primary stage of syphilis begins with painless sores called chancery. Sorry if I mispronounced that word. It appears at the site of infection, usually genitals, mouth, and rectum areas. It heals on its own, often without notice, so you wouldn't even notice if you have the sores because they're painless and you probably just think it's a normal thing. Infection continues even after sore disappears. So the infection is still in your body, guys. So it is important you do regular screenings and make sure you take any type of precautions. Many people often do not realize they are infected, guys. How syphilis affects your body? Usually get fever, rash, genital sores, muscle aches, swollen lymph nodes, and sore throats. And then there's secondary stage of syphilis. This is where symptoms become more noticeable. Rashes on palms and soles is characteristics. Fever, fatigue, sore throats, swollen lymph nodes is also a sign. Symptoms, again, may disappear and appear randomly. So just don't, if this is a thing and it is ongoing, please get checked. Infection remains active without treatment. So if you don't get no treatment, the infection's still in your body running through, and it's just going to get worse and worse. Because right now, as you can see all the rashes, the sores on his palms, around his face. And then the latent and tertiary syphilis. Latent stage, there's no visible symptoms. Infection remains in body and can last for years. And then the tertiary stage, severe damage to organs, neurological complications. It leads to blindness, dementia, and much more. Cardiovascular damage, and even it's often irreversible. As you can see, you see how it has, look, you can see from rash to like the skin peeling off and it's getting damaged, the teeth are damaged. You could also see problems in the eyes, blood vessels and stuff. Diagnosis and treatment. So in order, you get diagnosed through blood tests, penicillin is the most effective treatment for syphilis. Cure rates are to anywhere from 90 to 100%. Pregnant individuals must receive penicillin. Early treatment prevents complications and transmission. You see this is the hidden cures treatments of syphilis, penicillin. There's different types of penicillin, and it helps remove the infection from your body, often killing it. There's also, I would like to mention public health barriers. This is very important. You could do everything correct, but if you have lack of health insurance, you could also have transportation challenges, medical mistrust, and like I talked before, social stigma around STIs even. Limited education and awareness causes a lot of people not to be aware of STIs. So there is weeks dedicated to STI Awareness Week from April 13th to the 19th. This was for 2025 and 2026. I'm not sure. I believe it's the same week. No insurance can cause people not to go to doctors and get checked because of how much it costs. There's also transportation problems and medical mistrust, and social stigma is very important, guys, because we care about a lot of what people think, and that affects us to take care of ourselves. Preventing congenital syphilis is routine prenatal screenings is essential. Early treatment prevents nearly all cases. Many pregnant individuals lack consistent care, which leads to congenital syphilis and causing it to pass on to the kid. Housing instability and substance use increase risk as well. Congenital syphilis is almost entirely preventable since it can be cured with one injection or a 3-week course of long-acting penicillin, which just goes to show you if you take care and everything is like properly tested, you will be perfectly fine. So it is important to do testings and, be on top of your things. Talk to your doctor, get tested, and receive treatment. Okay? And then prevention strategies. Routine CSTI screenings and primary care. Community education to reduce stigma, I feel like is very important. Use condoms. When you make sure your partner is trusty, use condoms, avoid sharing sex toys and stuff like that. Even keep your partner updated if, God forbid, you do do something outside your relationship. Please don't keep it hidden because you don't want to infect other people. Also, mobile clinics and free testing should be more available, and integration with HIV services because HIV and syphilis do go hand in hand. And in conclusion, syphilis is preventable and curable. Rising cases show how systematic failures are not only medical ones. Congenital syphilis highlights gaps in cares. Early screening and access to treatment are key. Strong public health systems can reverse trends, and we need to do better as a society to be able to make it possible for every community and every class to be able to receive healthy and proper care. And that is it. Thank you so much for listening to me. Thank you.